one another. You're going to hear from Commissioner Malcolm. Once again, you're going to see that Minnesota has started potentially now up the climb that we thought would come, because we've had about 5 days of triple digits, and even though the testing at this point is not increased dramatically, those are still starting to show up. And of course, our sympathies to the families. We've lost 9 more of our neighbors. You're also going to hear about our plans to procure the PPE, and you're going to hear from some of our private sector partners in just a bit. I'll be talking about Ecolab CEO and Chair Doug Baker and the work he's doing with Commissioner Alice Roberts-Davis in securing that. And then we will update you on the situation at the Worthington plant, which we'll have Commissioner Leppink from the Department of Labor and Industry and Commissioner Peterson from Agriculture, because there's a lot of intersections there in addition to the Department of Health. So thank you all for that. And once again, Minnesotans, I would just tell you, thank you for doing what was asked of you. We are still maintaining that ability to push the curve out, flatten it a little bit, which was a positive. And my guarantee to you is if I asked the sacrifices of you, that we would build the teams necessary to produce the hospital beds and the critical equipment necessary to weather a wave of COVID-19 related hospitalizations. And we are on our way to doing that. There's more work to be done. And then also talked about how do we smartly put a Minnesota model together that allows us to do smart epidemiological testing, tracing, and isolation, and put together teams of people who are able to figure out what are those industries that we can bring back in a safe manner, making sure that we don't get in a situation while JBS was open, while Smithfield were open, they still are not immune from having clusters of infections that in the long run, if your workforce can't come to work, it doesn't matter whether you're open or closed by state stay-at-home orders, the facts remain the same. I spent the morning talking to many of our state's business leaders with Charlie Weaver and the Minnesota Business Partnership, and then spoke directly to one of our state's largest retailers about what it's going to take. And what I'm really encouraged about is the thinking and the innovation that's going in. I think most of these retailers and businesses understand they're going to have to change the way business is done for about the next 18 months. They're going to have to do that regardless of what a stay-at-home order looks like, because people are naturally understanding we're going to have to social distance, and their shopping and their retail buying experience is going to change dramatically. As I keep saying, very few people are going to go in and try on clothes right now, whether a retail store is open or not. And they're trying to figure out, and we're seeing some of the folks who are thinking this through, what will that experience look like for a customer's perspective as they walk through the door? They're talking to people about what it's going to take to get them back in. And I think that's incredibly helpful. And I think as we write these plans and the protocols for reopening Minnesota, that type of thinking is what has to be a part of it. And I think it brings me to my point about this team that's out acquiring personal protective equipment that are in part of this supply chain stream. That Minnesota's advantages, as I've said often, are a very robust healthcare system, a very robust and well-documented public health sector that is renowned for the work they do, a business ethic of philanthropy and community responsibility that helps creating public-private partnerships easier. And when we've started back in March, and I put together the team around aggressively going after personal protective equipment, we looked inside state government, and we brought Commissioner Roberts-Davis over from administration, and then we looked at companies across Minnesota, both big and small, who had expertise with this. One of the first folks we called I called Doug Baker, who's over at Ecolab, a company that has a little bit of knowledge in what it takes to keep things clean and to keep food processing and things neat and businesses running in a time when you need to decontaminate in a very fast manner, but also someone who runs supply chains globally with international companies and understands that now, because of the situation we were in, Minnesota was competing against surrounding states. We were competing against other nations to try and acquire that. And so you're going to hear from Doug and Alice here in just a little bit and the team that they put together. But I think the stories, and Ecolab is one of them. There are many others, and I want to call out a few of them. Of course, C.H. Robinson, Toro, Patterson, 3M, and Mayo. And there's numerous others. But one of the things is a lot of what these folks did is pro bono wise, as they were shutting down their operations, they were asking how they could help the state. And what they did was they gave us some folks over to help us. One of those was Joe Wyant. I want to get her title right. She's Executive Vice President and President of Global Regions. Jill is an expert over at Ecolab in procurement and supply chain management, and she's working with us pro bono as part of the team that's helping Minnesota. So I hope Minnesotans know this is an all-state effort. This is public-private partnerships. This is the best of our private sector. Some of the most successful companies in the world have given their people to come over to help the state do this. So you'll hear a little bit with them on the Critical Care Supply Working Group. They've been at it now for several weeks, and I think like anything in this pandemic, we have days where things go better than others, but all geared towards that idea that there will be critical equipment when needed. There will be an increase in the personal protective equipment so that we can expand out to further protect people throughout society, and that at the same time we're ramping up that the supplies inside the hospitals. So I'm going to have them come up in just a minute, and then we're going to update you on the Worthington situation. I think most of you by now in the media, folks listening today, is that JBS, the company that runs one of the largest Midwest pork producing plants, employs about 2,000 people in Worthington. Obviously, a critical linchpin of the economic and social fabric of Worthington and Nobles County. Over the last about 72 hours, started to experience increasing numbers of COVID-related symptoms. Once we got a team down there and started testing, it was led up by the Department of Health, the Department of Labor and Industry, and Agriculture. And I want to especially thank the folks down in Worthington. I was on the phone with Mayor Cooley last week, and the public health people down in Nobles County doing incredible work on this as we started to see a cluster of a very difficult disease start to spring up, doing everything right. And I think this morning JBS announced a voluntary indefinite shutdown of the facility to reassess what we can do to make that plant safe, what we can do to keep those employees safe. We have undertaken a robust testing operation, and I'm going to leave it, I think Commissioner Peterson and others will talk a little bit about this. The lessons learned in the JBS plant in Worthington are going to be applied to our other facilities, our other packing facilities across the state, because this is both numerous reasons. Obviously, the health of the workers. It's obviously the economic impact on these communities. But we have a responsibility here in Minnesota that we feed a large portion of the world. We are very much disproportionately the breadbasket of the world. And when these things start to shut down, and when you combine Smithfield and JBS, Commissioner Peterson will talk about this, it's a big portion of where our producers are sending their animals to market. So we'll hear a little bit about that. What I'd just like to, and I'll comment on this, some of you saw in last week, we had folks that are rightfully frustrated with the stay-at-home order. They gathered to express their constitutional First Amendment rights of disagreement. As I said then, though, I think there are safer ways to do that. I think in a global pandemic, we're always striking the proper balance between civil liberties and protection of a broader group of people. I mentioned last week that I was just a little confused about what we needed to do different when there was a just on Twitter from the president. So I called, the president called back on Saturday night. We had a very good and long conversation. I got the opportunity, as the president asked, what are we doing in Minnesota? What's the situation look like? I asked how we could align better with what the administration's proposals were put on Thursday, because I think they align very closely. We talked about some of the challenges around PPE and testing. But the one thing I think many of you have been in this room time and time again, I have been very clear. I am not interested in adjudicating why we don't have these things now. I'm just interested in how we get them. And that's what I expressed to the president again. I think he echoed that and expressed great desire to continue to work with us. He mentioned the great companies in Minnesota that are a part of the whole nationwide effort. And I think it just shows, and I'm convinced of this, that Minnesotans and Americans in general, they don't need to see us fight, and I'm not asking for everybody to agree with everything that's said, and I encourage people to, strongly as they can, continue to debate these in a manner that makes sense. I just don't think that there's any percentage in us not being totally aligned, and I left that conversation Saturday night believing that we are aligned, we are getting this right, that there's a confidence level amongst my team here that I think we're getting into a rhythm where our partners, whether they be at FEMA, had a great conversation with Secretary Espers at the Department of Defense, and now this conversation with the President, is in alignment. And I said I understand the frustrations, but I did express to the president I'm not sure that's really helpful at this point in time. And if there's anything that he needs me to do, it would be better to just call and we would talk. And I think we both agreed to that, it's just not healthy to play it out in a public setting where there's not a real back and forth and the ability to exchange information. So I'm grateful for that. I think there's reasons for us to be incredibly hopeful today with COVID-4 stimulus funding. We're talking to our delegation. I will say this, that I think the areas they're focusing on heavily, which looks like small business and hospitals, especially rural or specialty hospitals, is really wise. I will have to express this, that I think governors in general express this, and this is aimed at Congress, this is aimed at our strategy in general, that we're going to have to include the states in this at some point, because states can't run and should not be able to run deficit spending. But because of this, we're backfilling a lot of help into this fight against COVID-19. And if the states are not given part of this, that you're going to have a gap there too. And I think the president and the vice president's response to that has been that may need to be the COVID-5 piece of it. The problem is that states start to run up against this pretty quickly. I am pleased to say that they looked at states and did a stress test of which states are best prepared financially to handle this. And Minnesota was in the top 10 states. They said that is prepared to financially be able to put ourselves in a good position with our reserves, put ourselves in a good position with our ratio of spending and the stability of our pension funds. So at this point in time, good decisions in the past have put us in this position, but we certainly welcome the next discussion on what we're going to do to get Minnesota's economy back running in a safe manner. With that, I think I will bring up Commissioner Malcolm to update where we're at, and then we'll hear from Doug and Alice a little bit on procurement. Commissioner?
Thank you, Governor. Good afternoon. I'll once again just give you the data briefing. First of all, as of early this morning, globally, we were at more than 2.4 million cases and nearly 166,000 deaths. Again, as I've said many a time before, this is just a stunningly fast-moving virus across the entire globe. In the United States, early this morning, we were just under 760,000 confirmed cases and just under 41,000 deaths. Here in Minnesota, as the governor has mentioned, we are now at 2,470 cases, up an additional 114 from yesterday's laboratory confirmed total, and sadly an additional 9 deaths. Again, heavily concentrated, 8 of the 9 occurring in people associated with long-term care facilities, all residents again. Of the 9 deaths from yesterday, the youngest was in their 50s, a couple in their 60s, a couple more in their 70s, and the remainder 80s and 90s, the same pattern that we have been seeing. As of today, 1,202 patients have been released from isolation. There are 237 patients currently hospitalized, 126 of those in intensive care. We keep focusing on those metrics because that's been where a lot of the critical planning has been, to increase the supply to be ready for increasing numbers as we see them. I would like to comment just very briefly on the Worthington situation, knowing that my colleagues are going to go into greater depth. But from a health perspective, as the governor mentioned, we are, as we're getting case reports coming in, confirmed cases from geographic areas around the state, we were noticing an increase in cases in Nobles County. And as the disease investigators began their process of interviewing cases and identifying contacts, we fairly quickly spotted a strong link to the JBS plant. I will say that, and I appreciate the governor's acknowledgement, that our public health colleagues locally and at MDH, and particularly the skill of the disease investigators, is truly a great asset. There are some real challenges in this particular community with the number of languages being spoken. Over 40 languages are spoken in the JBS plant. A lot of these individuals don't necessarily have ideal housing situations in the sense of they're quite mobile. The housing is quite crowded. and some of them don't have telephones. So it's been a little bit difficult to track down, and so the investigations are taking a little bit longer than they typically do. It's been a point of pride for us that we're able to complete most investigations within 24 hours of getting a laboratory report. But so far, we've completed, of the 77 confirmed cases in Nobles County as of Saturday's testing, so we don't have all the results back yet from Sunday, but of that 77 confirmed cases in Nobles County, we've completed 41 of the interviews, so still have quite a bit more to go to figure out the total number. But in that first 41 interviews, 33 of them were employees of JBS and 6 are family members of the employees. So you can see the concentration there related to the plant, which is why it's so very important that we understand and get in there and understand more clearly what's going on with the plant situation. And we know, as we talked about before, the importance of congregate settings, whether we're talking about care facilities, housing facilities, jail facilities, or now we see and have seen around the country the potential for rapid spread in manufacturing facilities, especially ones of close quarters. So we could say more later in the briefing about the disease investigation process if you're interested, but we do appreciate the cooperation of JBS in allowing us to get a closer look at testing for the employees and families of that situation. I want to close with a bit of a good news story in a sense. You know that we've been working really hard to work closely with long-term care facilities who have large numbers or any cases. We consider, as you've heard time and again from Chris Ayersman and me, one case in a long-term care facility triggers a much closer hands-on approach from us because we know the potential with that at-risk population. We had a situation over the weekend with a particular facility in Wayzata there were a cluster of cases among staff, a few among residents as well, but we reached the tipping point where the staff was really unable to continue to care for those residents. So a decision was made Saturday morning, and by Saturday night, all 46 of the residents of that facility were relocated, either to their families on a temporary basis, to other assisted living facilities that were willing to take them. 7 were transferred to nearby hospitals to receive care. The point here was not that these relocations were triggered by resident illness, but by the lack of critical staff. And I just want to take a moment to acknowledge the incredibly hard work and the partnership and the teamwork that went into moving these people quickly and safely. It really took an extraordinary effort of our MDH staff, our colleagues at the State Emergency Operations Center, the Statewide Healthcare Coordinating Center, local emergency management, local healthcare providers, and other assisted living facilities that were willing and ready to be of assistance. So it was really a good news story in the sense of it was able to happen quickly, it was able to happen professionally without a lot of drama. Everyone is getting the care and the support that they need, and I am really grateful to the amount of teamwork that took. I think it just illustrates the importance of the interdisciplinary approach and the ability to move quickly when we need to. And with that, Governor, I'll turn it back to you.
Thank you, Jan. I'm going to bring Doug up here in just a second, but I think it's important, again, Minnesotans understand. Every morning I have a team that breaks down all of the lanes. This lane that Doug Baker's been working in, the Critical Care Supply Working Group, is these working groups brief me. Joe Kelly briefs in the morning about where we stand across the spectrum of emergency management, to include facilities that might be potentially stood up, flooding, and everything else that's going on in the state. We go right down the line from housing to education to the commissioner briefs. But I think one of the things that when you maybe watch these briefings, it's easy to forget there are literally tens of thousands of people carrying out this care for Minnesota that are doing all of these different pieces and working synchronization-wise. And one of the things that I think sets Minnesota apart, and we keep talking about this Minnesota model, is our private sector expertise is second to none and their willingness to help. So each one of these work groups has a lead in the private sector that's helping us out with that. So in the acquisition of PPE and getting ourselves ready, that's Doug Baker from Ecolab. Doug, thank you.
Thank you. Well, thank you, Governor, and thank you, Commissioner. I want to open by saying thank you to everybody here. Your team, this is a tough job. It's a tough time to lead. You've got very difficult decisions to make as you go through. I think it's very clear you're working very hard to understand all the issues. I said recently, if this wasn't hard, it would be because it was misunderstood. And clearly, these are difficult decisions, and we all have confidence in the business community. You're working very hard to get this right. Human health is absolutely critical, and obviously there's economic health, and these two meet, and that's not an easy line to cross and to figure out. So we empathize, and we also really appreciate all the hard work that's been going into this. I'll say this is a easy call to answer, and I was delighted we could help. I will be remiss, I'll say this 3 times. If you have a big job, you smother it with talent. I can see that the governor believes in the same ethic. That's how we have Commissioner Alice Roberts-Davis here. And I would also say from our end, we asked Jill Wyant, who is repatriating from Zurich, moving into a growth and innovation job globally for me. And it's hard to grow when everybody's home. So to think that maybe her helping unlock the state, because if you don't have PPE and you don't have this stuff figured out and the reserves right, it's very hard for the governor and team to give a go-ahead ultimately to reopen the state. So this all, in a lot of ways, works. Jill has done a great job, but it's with the leadership of the commissioner and her team. And last I'll say is this. My big job was making the business community aware of the challenge. They volunteered, and you listed a number of them, and I'm just going to do it again. So I sent a letter out on Friday, and by Monday, we had like 10 people volunteering. And what we're doing principally is using their procurement teams. So we all have offices all around the world that can buy things. We have people in China, they can inspect and buy things. This is already built. So to use this team in this instance seems a very wise way for us to help quite efficiently. The state doesn't go out and do this by nature. And so this is an emergency time where we can help in a very unique way. But 3M, Donaldson, C.H. Robinson, Mayo, Patterson, Polaris, Toro, Target, and of course, Ecolab's purchasing, all of them have really stepped up in the procurement, logistics, warehousing management, whatever way they can. They've really stepped up in a number of ways. So that's all I'd have to say, and we appreciate the opportunity. Thank you.
Commissioner? Thanks, Doug.
Thank you, Governor. Thank you, Doug. As I've said before, we continue to be competing for supplies with 49 other states and many countries across the world. This has really been a very special relationship with Ecolab. Over the past 3 weeks, we've been leveraging our traditional supply chains, but also had many Minnesota businesses step up, some small businesses that pivoted from their normal operations to assisting the state, and then, of course, what Ecolab did, which was different. They made the call. They asked Minnesota corporations to step up. They asked them for their top talent, and they really responded. And so from all of those companies that you named, Doug, we've gotten some of their top talent, and they've been so helpful for us in vetting procurement leads and vetting vendors, which we were flooded with in the very beginning. Not necessarily all from good actors or people with good intentions for supplying the state. In fact, just this past weekend, 3M was able to quickly identify for us a vendor that was counterfeiting 3M masks and selling them, and so we were able to abandon that lead and spend our time more wisely. So we're very appreciative of all of the great work that this group has done. We're continuing to build capacity. We're placing orders daily and receiving orders daily, but there's still a lot of work for us to do in order to be prepared in healthcare settings and long-term healthcare facilities, daycares, and shelters across the state. But I am really heartened by the commitment of all of our private partners and us working together. So again, just a really heartfelt thanks to Ecolab, to Doug, to Jill, and to all of the partners who stepped up and helped us in this effort.
Thanks, Commissioner. Thank you. I'm going to bring up 2 commissioners. You haven't seen much here yet, but they've been working nonstop. Nancy Leppink is the Commissioner of Department of Labor and Industry, and I think my colleagues across the country and others would say this, is probably no one more talented in keeping workplaces safe, labor law, labor interactions, and having her on the scene to try and understand how we can keep these businesses running and keep employees safe is absolutely critical. And of course, Tom Peterson, Department of Agriculture, as I said, I think I go a lot of places, and every time I get there, people tell me Tom's already been there. And I feel like I know a lot of people. Tom not only knows them, he knows all their children and the dogs and cats that are with them. So these are two good people to have on the ground when it comes to an intersection between labor and agriculture. So Commissioner Leppink and Commissioner Peterson.
So good afternoon, everyone. I've been asked here today to talk a little bit about the work that we're doing in light of the cluster of cases that we have found in the Worthington area and in Nobles County. So when it appeared and became clear that a significant number of these tests were from with employees who were employed by the JBS meatpacking facility, and of course that followed on the heels of the Smithfield facility and other facilities across the country having similar challenges. First of all, and most importantly, the Department of Health and the Department of Labor and the Department of Agriculture worked to develop guidelines now for the meatpacking sector to assist them in coming into compliance with CDC guidelines in their facilities. Furthermore, we will be sending out that guidelines to all of the facilities in the state and offering the assistance of the state to help them develop the plans that are necessary and improve their operations in a manner that allows for them to comply with those CDC guidelines. We've also requested that those facilities, because often our knowledge about whether there's something going on in a facility we only learn that after we've done testing, and the testing questions ask people then, where are you employed? So we are also asking for these facilities to voluntarily share with us the health status related to their workforce. So have they had workers who have tested positive? Have they had workers who have been symptomatic and sent home? Have they had workers who have called in reporting symptoms of COVID-19? And this will allow the state then to focus its testing resources more effectively, but also that we can get into those facilities and work with those companies to help them identify and potentially change how they're operating in order to meet the CDC guidelines. So, and we know that there is significant pressure on this sector regarding the demand of the agricultural industry. So our objective is to keep these plants open, but however, to keep them open in a manner that they do so to keep their workers safe. And so that then really means that there has to be a strong collaboration between health and labor and agriculture to truly meet, to see how to thread that needle in this industry. So the department is committed to working with health and agriculture. We have amazing partnership there, but also to do our job, which is to ensure the safety and health of workers and workplaces across the state.
Well, thank you. I think for Minnesota's agricultural industry, this is obviously a very tough time, as it is for all Minnesotans. In our, COVID-19, thinking back to our farmers before we even had COVID-19, we'd faced 5 years of bad prices before this ever happened. And so to have this on top of it is very difficult, especially right now for our pork industry. And keep in mind, Minnesota is #2 in pork production in our nation. We're here to do whatever we can to support our farmers and to support the people affected by JBS's plant decision to suspend operations today. And we've been working with our Worthington plant's leadership and the employees to help them find a way to resume those operations as soon as possible. In the meantime, I want to just say that our pork producers, we have enough pigs to meet our demand right now. But with closures of packing plants and processing facilities, it's going to make things very challenging. We also want to make sure that we reemphasize to the public that there's no evidence of food or food packaging being associated with transmission of COVID-19 and pork processing, it means it's safe to consume pork, especially using everyday safe food handling techniques. Farmers are losing money on every animal day. It's not just hogs, lamb, cattle, dairy, eggs. It's across the sector. U.S. pig farmers are estimated to lose $5 billion for the remainder of the year. We also want to say that we're doing everything we can at the Department of Agriculture to assist our producers at this time. We have assigned staff members to help farmers that have lost markets. And so farmers that are looking at that can go on our COVID-19 webpage, and we can connect them with our staff people who will do their best to help them find markets. MDA is in constant touch with the other plants that are operating within the state. We have roughly 20 other large packing companies, and our goal, as Commissioner Lepnick said and the governor said, is to keep those plants running. It's incredibly important. In the meantime, the Department of Agriculture is working with a lot of our smaller plants to build capacity within the state. Those would be what we call our equal to or custom plants. We this last week gave out $345,000 in value-added grants to those plants to increase capacity to handle those animals that we're seeing. We also want to just remind people that this is a very stressful time for our farmers, and that we have resources at the Department of Agriculture that are free for our farmers to use. We have a mental health line, and we also have 10 farm advocates. I spoke with them on the phone this morning, and we know that it's tough for farmers, but we also want farmers to know that there's resources out there to help them. And so this is a tough situation. We'll work together with our other state agencies, our other states, to get through this. We want to make sure that we ensure that Minnesotans have a safe, affordable, and accessible food supply. Thank you.
Thank you, Commissioner. Well, thank you, everyone. Doug, I go back to that smother it with talent. Minnesota has a lot of that, as you can see with these commissioners who are up here. I talk about these two who don't get up here a lot, but I talk to an awful lot. And, of course, trying to go find that talent. Commissioner Lepink was based in Zurich at the time when we were out looking for someone to fill that position, and we had to do her interview via Skype from Morocco. A native of Two Harbors wanted to come home and serve the state, and so I'm grateful for that. So with that, we're open to the questions from everyone. So, Mary?
Governor, you mentioned earlier 18 months for businesses to prepare that business will not be as usual for 18 months.
Yeah, I think that's the way they're viewing it. Yeah, well, they're viewing it from the outside numbers from CDC on a vaccine. I think most of us recognize behavior is not going to change dramatically until there's a vaccine. I think certainly therapeutics, Chris Erzman and some of the infectious disease experts would tell you this, but the businesses themselves are saying they're doing their work, that they understand customers and they understand customers' thinking, and they're out there looking to what it's going to take to get people back in their stores. What's it going to take to operate your restaurant once we have social distancing? But if we open restaurants without a vaccine, will people come? How will that look? So I think they're thinking, and to be honest, in speaking to this major retailer this morning, they're thinking this could be a long time or even a generational shift in how people view retail. And they're starting to think that way of what does it look like if we come back, and when we come back, are we going to approach it differently? So one of the good things, though, I think for us right now is having all that talent and having these business folks think about this. They're creating plans that are going to be solid, that will feed in, that will help us make these decisions to open up. That's what we're not going to be able as a state by ourselves in a vacuum to be able to create, this is what a safe business would look like and this is how you can make it work. We're going to have to go back and forth with them, working with health and saying this is how you do it. Exactly what you're hearing about JBS. How do you open back up a hog processing plant in a manner that stays safe and separated? Does it make sense to operate it at a slower speed, and how many hogs can you move through there? So I think that's how they're thinking, and they're looking, and I think their long-range vision is vaccine.
But to follow up, what are you thinking? How does that change your thoughts on what businesses open and when there's a lot of pressure still on restaurants?
Yeah. Well, I think it has to be driven by the science and the data. When I heard people say, if there are protocols in place that are keeping essential businesses open, by the things that they're doing and not getting people sick, wouldn't it stand to logic that you could apply those to non-essential and do them the same way? And the answer to that is yes. But I think today the JBS and other situations show this. It makes no difference whether you have a stay-at-home order or not on that if people are getting infected and not able to come to work, meaning you could not have one on and it would still shut it down. So the way it impacts me is that I think day to day is what I keep telling people, we need to find out what things are working. How can we do this? And again, I don't know yet on antibody testing. I think we've talked about this, Jan certainly has, that the drawbacks of antibody testing need to be taken into account with the great potential promise of that. So we're looking long-term about what it will take, but I'm looking with this team with best practices of saying, is there a way? Because from the very first day this thing started, and people were talking about shelter at home and we're talking about 18 months, I said, it's not feasible to shelter in place everybody for 18 months. It is just not sustainable. It's not sustainable economically, it's not sustainable health-wise, and it's not sustainable psychologically. So we're trying to strike that balance, and I would thank Minnesotans again. I get a report on social distancing and things that are happening. We opened up a lot of activities for outdoor activities over the weekend, and almost no complaints. People were adhering to them. Now, obviously, there'll be a bit of a lag time if people are gathering too closely or we're getting spread of the disease. So we're looking at it both triaging short term, but then thinking like these businesses are, what does resumption of state business look like until we have a vaccine?
Governor, if I can ask you to go into more detail about your conversation with President Trump. The tweet, "Liberate Minnesota," certainly took, most people interpret that as a direct rebuke of you and your policies. It sounds like he may have called you back. And also, did you tell him what you thought of that tweet? And what do you think of that tweet? What was it like?
He did, yep. The president called, and we have spoken on numerous occasions. He has called on several times prior to COVID-19. I was very appreciative he would take the time and called back. It was probably close to a 10-minute conversation, and I just explained to him, I said, I know, Mr. President, you don't have time to know everybody. I said, I've been in Congress. I've served under 3 administrations or served with 3 administrations in Congress. And I said, one of the things I pride myself on was being a low-maintenance member of Congress, meaning I didn't need to have the White House call on everything, that we did our homework, we did our stuff, and we worked together. And I just said that I wanted to get the opportunity to explain what we're doing to make this a little clearer. I said, I understand there's frustrations with folks wanting to stay home, but here's what Minnesota's doing, and I want to understand, is there something else you'd like us to do? And at that point, the president said he appreciated that. He said, I am hearing good things. I think it should be noted that I think there were prominent Minnesotans that placed calls to the White House and said, you know, maybe talk to the governor. He's trying to get this right. And I would, if those calls were made, I certainly can't say that specifically, but it sure sounded like somebody called, because the president said, I'm hearing from friends in Minnesota that you're doing things that need to be done and you're listening to them. So I appreciate that. And so I think it was more of kind of a level setting again. The president asked about testing, and I said, we're turning to Mayo, the University of Minnesota, in our health systems across Minnesota. I said I appreciated, because this was after his news conference yesterday, I said I appreciated the Defense Production Act focusing on swabs and some of that material, because I said, for whatever reason, there is a little bit of a problem with that. And he said that'll be taken care of this week. And then I just asked, I said, if we're getting something wrong here, we're getting something that, can we call or can we talk? And he said, absolutely. And he said, I appreciate this. We'll talk soon. And then I just saw this morning, they said that the president put out a tweet and said the conversation, I think he summed it up the way I would. It went very well. We committed to working together. And my talk to him is that he can tweet what he wants to, and that's right. But I said, I think here in Minnesota, they really, really want him to succeed. They really, really want our state to succeed. And I said, if we can work together, this is not an either-or proposition. And so I felt certainly better about it. I think, again, we'll see how things go moving forward. But Minnesotans should expect that that's what I'm focusing on. It made me just a little more comfortable that we're not going to get sidetracked into things that take us away from the main mission.
You mentioned that there may have been some calls on Minnesota's behalf. Can you
You've been watching a live press conference from St. Paul about Minnesota's response to COVID-19, an emphasis on how the state is working with the private sector on their COVID-19 response today. We also just heard a few more details about Governor Tim Walz's call with President Trump. He said that took place on Saturday night for about 10 minutes and was cordial, and they agreed to work together in the future. We'll bring you the latest on our website and mobile app and on WDIO News at 5. See you then.
This has been a WDIO News special report.